Hello there, my name is Gilbert Vasey. I'm a director with the Specsavers Group. I practice at Crystal Peaks in Sheffield. I'm also an optometrist. That's the first job I qualified in. I happen also to be a chartered accountant, but it's optometry that we're looking at today. The route to becoming an optometrist was back in 1982, and I'm afraid, yes, that does age me. There was no jobs available, and this was one of the professions where there was 100% employment post-qualification. So it was that, as well as the fact that I wanted to go into something that's quasi-medical so that I could make sure I had a profession. The qualifications I've got: I have a bachelor's degree from Bradford University, I've got a master's degree from Bradford University, another master's from Ulster University, which was to do with cataract and refractive surgery, and various things in accountancy as well. Your average optometrist is working from a consulting room most of the time. Within the consulting room they have various different pieces of equipment which, if you've been for a sight test, you'll be relatively familiar with. The first one would be the ophthalmoscope. That's one where they come up close to the eye and they get really, really close to you, and you really want to laugh at this point in time, and we know you really want to laugh, but the purpose behind this is it gives us a view inside the eye. It lets us view the retina. At another point during the test, we would also use another slightly different device. This is just a head that fits on here. This is called a retinoscope. The retinoscope allows us to measure the power of the eye by using a line and then using different lenses in front of the eye to get a good idea of what prescription you are without you having to tell us anything. Something else that you may be familiar with as well is obviously the use of lenses if you've been for a sight test. The trial case and the trial frame, which we use the lenses in, this is what you may regard as the normal. It's certainly something we've used for years and years within the profession. What we're tending to do now is move away from that and move into using devices like this. This is called an on-orthopter head. This is an automatic version. All those lenses you saw in the trial case are actually kept within here, so everything we need to do with those we can do in here. It just makes it easier for the patient, and it certainly makes it a lot easier to show the changes in prescription so you can judge for yourself whether there really is any difference. Along with the other devices I've mentioned in the consulting room, we also use a device called a slit lamp. It gives us a magnified view at the front of the eye, so we can check the cornea, the lens in the eye, the iris, things of that nature. We can also, with this, get a good view actually inside the eye using a condensing lens. This lens we place really close to the eye, not on it, but very close to it, and looking through this with this device, we get a 3D image of the retina. It's fairly small, and you have to get used to it because it's inverted as well and reversed, but once you get used to that, it's a very, very good way to view the eye. There are other lenses we use in practice as well, such as this device, which allows us to get an indirect view inside the eye, so you can sit much further back to get a view there as well. So lenses are something which are used now and again within the consulting room itself. Lenses we use are actually kept elsewhere. We don't have room for them in every single room, and because we don't use them for every single sight test, we actually keep them in a separate area where we can use them on demand. In terms of the sight test chart, which you'll be very familiar with, I'm sure you've seen them start at the big letter and go all the way down. With this form of consulting room, which is a short form consulting room, it's all just within this little box here. You can see the letters into the chart there at the moment. This will just help us gain a rough idea of what sort of quality of vision you can achieve. If you ever wondered what the red and green test, if you've ever had one of these tests done before, that gives us a slightly more fine adjustment. It's a terribly difficult one for a patient to judge on, but it gives us a fine adjustment because of the splitting out of the colours with the prism effect. They're actually going through, being refracted by the cornea. You may also see the dots, or sometimes they have a dial with a thing that goes around. This is to help us measure the degree of astigmatism. Astigmatism being the distortion to the shape of the eye, being more shaped like the rugby ball than the football, but it's quite a symmetrical distortion. That we can correct with lenses. Going back to the letters, again from here we can get a good idea of the degree of long-sightedness or short-sightedness. Short-sighted being that you can actually read up close to, but you can't see in the distance, so you have good short sight but poorer long-sighted vision. Long-sightedness is where you actually see very well in both distances, but when you come to do the reading work, it's actually a lot more work for your eyes to cope with, so they tire very, very quickly and you're more likely to get frontal headaches. So part of the role of the optometrist is to screen for eye diseases. If we find eye diseases, what we tend to do then is either monitor them if they're not treatable immediately, or we'll refer on to secondary care into hospitals for a view from an ophthalmologist who is the medical specialist on the eye. In the practice, we have instruments that measure various different things. One of the ones that plainly look the nicest is the fundus image, the view at the back of the eye. Here you can see the optic nerve, the little area just here. That's the tube that effectively goes from the eye back into the brain, where all the nerve fibres flow down there. That's an area where we look for things like glaucoma, because some changes occur there which are fairly typical of glaucoma. We've also got the blood vessels as they spread across the retina. You can see them there. Those again we're looking for various conditions that may affect blood vessels, such as diabetes, where you get leakage from the blood vessels, which is fairly again common and a classic view on the retina. You may just see a little cherry red spot in the centre there. That's the macula, the very fine point of vision, the part that gives you the quality of vision within the eye. So much as the fundus image, or the picture of the retina we've just seen, is a view straight onto the retina, we also have another device called an OCT, which is an optical coherence tomographer. That gives us a cross-section through the retina itself. And we've got an image here of just that. You can see it thins down to a very tight point. That's again the macula, that very fine point of vision within the eye. In this case it's quite healthy. In other cases you can see some quite dramatic changes to the macular area, which will cause things like macular degeneration, macular edema, the swelling of the macula. So there's various conditions of that nature we can also look at. The OCT also helps us with the diagnosis of glaucoma. What it does is it gives us an imagery of the optic nerve head, that little tube that goes from the eye back into the brain that carries all the nerve fibres. And it's actually measuring the thickness of the retinal nerve fibre layer. You can see that in the little graph here. If it's in the green zone, that's very good, that's where you should be according to your race, your age and your gender. And these little circles here tells us the degree of the thickness. If it's green, that's good news. If it isn't, well, you start to get suspicious and you need to monitor things. This device actually replaces the retinoscope we used to use in the consulting room. It's an electronic form of doing the same thing, so it gives us an idea of what the power of the eye is. It's also the device which measures the pressure within the eye, the intraocular pressure. It does that with a little pulse of air you're very familiar with. This device measures the thickness of the cornea, the central corneal thickness. The importance of this measurement is it helps again with the diagnosis of glaucoma, and also it's got a lot to do with whether you can go forward for refractive surgery, whether the laser surgery itself is going to be successful on the eye or not, depends on the thickness of the cornea. This is the OCT, the optical coherence tomographer. This is the device which creates the cross-section through the eye. It's completely painless for the patient, it's all just optically driven. It's something that can be taken as a measurement within a minute for both eyes.